Oh my gosh, I've been recording this whole time. That's so funny. Hello everyone. My name is Dr. Chelsea. I am the program manager for the Region 10 Opioid Abatement Council, otherwise known as Gateway to the Rockies or GROC. Today we have a hybrid meeting for June in Clear Creek County. Thank you for those supporting the sound check. We are going to go ahead and get started with attendance and quorum. Commissioner Dahl-Kemper.
Here, good to see everyone.
Commissioner Marlin.
Here, hello everybody.
Commissioner Hollingsworth.
I am here also.
Commander Ayton. I do see him in the room.
Oh, there it is. Good afternoon. I'm here.
Yes, thank you. Heidi McCollum or Stephen Potts. I saw Heidi. Check to see if she's still in the room. Think so. Heidi dropped off. Sheriff Armstrong or Greg Demo? Oh, Heidi McCollum.
I'm the Sheriff. Demo's here.
Thank you, Demo. And then Heidi
Sorry.
McCollum. It's okay. Heidi McCollum did enter the room again for the record. Laura Weinberg or Chris Wolf?
This is Laura. I'm here.
Thank you. Tori Jantz or Troy Cooper?
Tori Jantz is here.
Janine Mariani?
I'm here.
Thank you. Dr. Story is in the room with us. Dr. Ryan or Emily Cooper?
I'm here.
Marie Larson or Elisa Witt?
Hi, Marie is here.
Thank you. Mary Berg or Barb Weinstein? Sorry.
Hi, it's Barb. Hi, everybody.
Sarah Casano or Dr. Gillingham?
Sarah Casano is here. WebEx is not recognizing her mic or camera, so she might be chat only or until she figures that out.
Okay, Sarah is here for the record, but WebEx is not recognizing her microphone, so she will be utilizing the chat. Janie Barker or David Jocelyn?
This is Janie Barker. I'm here.
Thank you. And Kristen Heath or Judge Jones?
Hi, Kristen Heath here.
Thank you. I did drop a link in the chat for our non-voting members. If folks could please fill that out, and we will read your attendance at the conflict of interest section. Governance approval of the May 18th meeting minutes. Looking for a motion and vote.
No comments. I'll make a motion to approve the May 18th meeting minutes.
Second, this is Leslie.
Thank you. We'll vote by opposition in the chat or in the room. And nothing, so those are passed. We have our June 22nd conflicts of interest. All of our Jefferson County voting members have a conflict of interest due to GROC funding for Jefferson County Sheriff's Office and Jefferson County Public Health. Amber Dower is the fiscal contact for GROC and is a Jeffco employee. She's actually on vacation, so she's not here today. Clear Creek County voting members have a conflict of interest due to GROC funding for CChat and Mountain Youth Network. Gilpin County voting members have a conflict due to GROC funding for Gilpin County Sheriff's Office and Gilpin County Parks and Rec. Rhiannon Strait and the Omni team received funding for program evaluation and facilitation support. They do have an agenda item today. And then let me go over to my check-in that no one has filled out yet. for non-voting members. We do have Michael Miller is with JCPH. That has an agenda item today. He's also on the executive committee and an alternate for Dr. Story. Theodora Barchewski is from the Colorado Coalition for the Homeless. No conflict of interest to report. We have Clear Creek Commissioner Rebecca in the room. No conflict of interest to report. Dana DeHarris Smith is the only person I do not yet know. Do you have a conflict of interest?
I do not.
Thank you. Please remember, for all non-voting members, please fill out the attendance check-in for record. I just put that through the chat again. For governance, our advisory committee, which is referred to as GRACE, has a mid-year check-in. Membership updates, people rotating off, switching, and new names. Nothing right there. We do have new names for our non-discretionary. As a reminder, our non-discretionary advisory committee members must be nominated by a voting member and then voted on by all voting members. They serve a 2-year term. The non-discretionary members are Peggy Jarrett and Dr. Annette Cannon. Peggy Jarrett is with Intermountain Health. She is Amber Qatar's counterpart at Common Spirit. Dr. Annette Cannon is the coroner for Jefferson County. And she was part of the original advisory group, but when we were in the process of transitioning and formalizing that group, got lost in transition. These names have been recommended by the current advisory committee and by the executive committee. I am going to open the floor for questions about these nominees, and then I will look for a nomination from voting members.
How large is the GRACE?
My regular attendance is about 8.
But it's unlimited?
It's unlimited.
I don't have any questions. I'm not hearing any questions from anybody else. I'll make a motion to, it's the point, right? To appoint Peggy and Dr. Annette Cannon. Sorry, Peggy's last name.
Jarrett.
Peggy Jarrett and Dr. Annette Cannon to the advisory committee with gratitude.
Second.
The motion was by Commissioner Marlin. The second was by Commissioner Hollingsworth. We will vote by opposition in the chat or in the room. Awesome. Congratulations, Peggy and Dr. Annette. I will get you a calendar invite and look forward to seeing you the first Thursday of July. Our next item is a discretionary member. Discretionary members are for all school districts and fire districts with populations of 25,000 or greater. They are appointed by the commissioner or their delegate of the county. Their term is unlimited. So we have a name switch for Clear Creek Schools. It was Sunny Vincent, and it will now be Sydney. I don't know her last name.
Sydney Lynch.
Sydney Lynch. Is that official?
Yes.
All right.
Sydney is on the Clear Creek School Board. She works as a nurse and is very interested and uniquely qualified. So we're excited.
Awesome. Thank you, everyone. So I'll go ahead and get the advisory committee handbook updated with these names. We will revisit this in December. That way we have January appointments. I am looking to do these twice a year, every January in either June or July. Brief finance report. This slide has not changed. This is just telling you what we have, our total funding to date, minus our 23 to 25 expenditures that were reported. And then our 2026 expenditures to date, I guess that number did change. I did not update it. How much money we have allocated to a funding area and line item, but it is not obligated, or these are obligated, and then these are not obligated. So the obligated is the awards that we have actually given out. To date, CCHAT has expensed $314,265 and some change. They have about $775,000 remaining. Denver Recovery Group has expensed about $18,000. They have roughly $160,000 on their award. They are due for a renewal. They'll be filling that out due July 31st. Their contract ends November 30th. Lakewood Co-Responder has not yet expensed. They are expensing quarterly. They have been in communication about hiring delays, but they did just hire someone. Jeffco Public Health, they do invoice quarterly, and since this is internal to Jeffco, there was some confusion about how they should invoice in Workday versus a UNA versus both. They did invoice. We have not yet processed it. That is an agenda item today. Jeffco Sheriff Biometrics, their contract is in the signature routing process. They will have a July 1st start date. Recovery Works has expensed a little over $62,000, leaving $508,000 on their 2-year contract. Monarch was an upfront home investment, so that $1.2 million is already expensed. Advocates for Recovery Colorado has expensed $505,000, a little over that. They are up for renewal due July 31st. Their contract ends mid-September of this year. Resilience 1220 has expensed almost $98,000. They have $287,302 left on a 2-year contract. Mountain Youth Network, they had a June 1st start date. So we did shift their award because of their Epic award. So their first invoice will be coming in on July 10th. And then Gilpin County Parks and Rec has expensed $143,254. So they have a little over $42,000 left on their contract. EUNA is a 5-year contract. We paid year 1, that was $17,000. And then after the first 2 years, that will move to our accrued interest fund. The program management and facilitation, so that would be my line item and part of the Omni's facilitation line item, has expensed $167,084.46, leaving $157,615.54. The program evaluation line item has expensed a little over $45,000, leaving almost $75,000 left. The emergency fund has been reallocated to the accrued interest fund. We have not yet expensed that. Training and development, it has expensed $11,250. That was our state sponsorship in October. The 6 people who were sponsored to attend the National Opioid Conference last week, we will be hearing from them at our July meeting. The state has also advised that the $2,400 that was approved for me to attend the UNA conference in September be allocated to this same line item. So we will be moving some funds around, and I will go over the strategic plan with the executive committee. The fiscal agent they have actually not expensed anything. This was mileage for travel for me between meetings using a county vehicle, but that should actually go in this line. We're working on fixing it, so that'll be updated. Any questions about our monthly expense report? All right. General update, the Colorado Opioid Abatement Council, or the COAC, has announced their state conference will be on September 30th at the Copper Mountain Conference Center in Copper Mountain, Colorado, from 8 a.m. to 5 p.m. This is a no-cost state conference. And so I will keep the council posted on when the registration opens. We have not yet discussed if the GROC would like to cover mileage or room reservations for the council. So I will add that as a July agenda item. Something to think about. Grantee progress report, Gilpin County Parks and Rec, their van use agreement has finalized since I sent out the meeting materials. Jeffco Public Health does have an agenda item today. JCMH Soteria Landing, that's one of our capital investments. They have a July 1st start date. And Jeffco Sheriff has routed for signatures, and we are anticipating a July 1st start date. There are no other grantee updates at this time. Summit planning, we have Red Rocks Community College on Thursday, October 29th. The initial invite list was approved. Those went out May 1st to the 31st. And then we have our second round of RSVPs going out July 1st to the 31st. So today we are just finalizing the second round invites. We have roughly 72 people who have RSVP'd so far. If those folks who got requested additional attendees get those, that would put us about 82 conservatively. Still working on those bigger organizations like the Behavioral Health Administration, Colorado School of Public Health, to get invited. The list was approved and recommended by the advisory committee and by the executive committee. So just looking for a final kind of approval on this before I jump into catering updates.
You need a motion.
Yes. Oh, I did
For like anybody question or want to change it.
a motion to finalize it, but I did actually add 2 names from the conference that I met last week who I think would be great additions. No, I don't want to merge shelves. I need to hide this.
That's a good idea. I think.
Did you meet
I
anyone?
think that we met some people whose names don't come to my mind right now, but I have the info that we could propose.
I know one of them was the Colorado Health Network. They are doing syringe work with other ROACs, and that is of interest to Clear Creek County specifically. Did anybody else meet folks at the conference that we should add?
I'm not remembering his name, but we tried to get him onto our advisory committee as well.
Dr. Stater's already on here.
Dr. Stater, good.
He RSVP'd, yes.
Okay.
Kim Bolden from Matters has a treatment platform that does warm handoffs. Both of you spoke with her. I know that they are applying to the DOAC next month as like a pilot, and then they would reach out into other ROACs, but we have discussed warm handoffs in treatment in this group.
There's the woman that spoke on the employer welcoming, kind of looking through. I don't know.
Recovery friendly workplace.
Yeah.
That is
Are they on?
the Centers for Health Work and Environment, Colorado School of Public Health. They have the Recovery Friendly Leader Initiative funded by the state. I did find a generic contact for them. They can't hear you, Sandy. You gotta.
Lily Tenney.
I can email Lily.
Okay. Because they were good.
And then it might be interesting to have someone from the Oxford House.
Oxford houses.
They've got a lot of houses in the region.
So the problem with Oxford houses is they support all substance use and they cannot delegate a house as opioid use only. So we do run into a serious issue of supplantation concerns by
That's if
funding.
they apply,
That's if they apply.
but to attend the. if
Yeah.
they attend,
I can add them.
that'd be good for networking all around.
Do we want to invite all sober living homes into it? That would be 10 operators. We do have Linda Behringer from Just Living Recovery as an advisory committee member. Monarch is a funded partner, and then we would have Oxford House.
Dr. Chelsea, I just wanted to call your attention to the chat. You've got Dana from Porchlight Health, who's a treatment provider. Side note, like, works with Dana lots. They do incredible work, offering to maybe be an attendee in the chat as well.
Where is Porchlight located? Oh, Region 10.
Am I able to speak?
Yes.
Okay.
Yeah,
So we've got clinics all over the state, but we've got a clinic in Lakewood, which I believe sits in Jefferson County. We also have services in Golden.
Okay.
And our Lakewood office offers outpatient services, including outpatient withdrawal management.
they're a great support to our law enforcement. Yeah.
Thank you, Dana.
Is Generation O, do they have anyone locally?
Commissioner Hollingsworth asked if Generation O has anyone locally. Who are they?
They were the ones that were speaking about babies that are born to and how prevalent it is and how underserved.
I can connect with Raquel Garcia at Hard Beauty. She would know if they are connected.
And that was the other one on my list is I had a conversation. Hard Beauty, they're providing services in Region 10. They're coming.
Yeah.
Okay, good. They're doing like maternal health services at Lutheran, I found out. So, and as far as Oxford House, in a brainstorm they came up, but I don't know that they're more appropriate or less appropriate than any other recovery sober living homes. My understanding of the settlement agreements and the MOUs is that this funding can address more than opioid use disorder.
Co-contributing and co-incurring, yes. The line of when it drifts out of purpose and scope is not clear. More we can talk about. But I think we have enough space to invite them.
If we have space, yeah, I'll generalize the comment. Some sober living homes, I think, are important stakeholders. It might be nice to just look at the list and see in our funded buckets if we're like missing important segments of our funded buckets. Like, do we have some harm reduction folks? Do we have recovery folks? Do we have treatment folks?
We do. We have every area full. In the initial invite list, there was right here.
Oh, look at you.
Yes, making sure we have representation.
So it's prevention and recovery. Have we invited our youth groups?
Yes, they're all coming. All the youth groups are coming. If this is good, I will go ahead and send out the list and bring a final back to the executive committee the first week of August. In terms of the budget, my goal is to keep this under 6,000 as much as we can. We have $0 on the room rental. We will be paying $300 for AV or technology services. Wagon Roasters Coffee is a woman-owned coffee company in Denver that hires individuals in recovery, and the owners are in recovery. So we would be picking up coffee, to serve roughly 150 people for $500. For breakfast, we are considering biscuits and berries at $10 a person, or Santiago's and Golden. Aiming breakfast for roughly 80% of participants, since most folks will probably have breakfast before they come. For lunch, we are looking at Jason's Deli for $13 per person. I was quoted $2,250 before I had them take the tax off because we are tax free. Drinks we'll get at Costco. I have a Costco membership, so I will prospect a number this weekend when I go. Making badges for 150. I will get on Amazon and do that. Printing. Thank you, Jeffco. I will have to see how much they are going to charge our account to use a ream of paper. And then the advisory committee and the executive committee really like the idea of tote bags from Elevated Impressions. This is a women-owned company in Gilpin, which is part of Region 10. She is in recovery from opioids, and is giving us some discounts because she really appreciates the mission of GROC. And so we love the idea of marketing and recycling and getting tote bags out. So we are looking at roughly $1,200 for that. This again is not final, so I'm not asking for a motion. This is just kind of a notice. The final budget should be coming in August. If there are any comments, please let me know.
Thank you for all your planning.
You're welcome. Next agenda item is a EUNA implementation update. Yes. Oh, on the names. Yes. Thank you.
Just quickly move, we approve the final invite list with authority through Dr. Shore to add additional people to the invite list as needed.
I'll second, absolutely.
And vote by opposition in the chat or the room. Perfect. Thank you. Back to EUNA implementation. So in October, we procured EUNA, also known as eCivis or Amplifund, as our grant management software, so that we can administer funds in a more transparent, and accountable way. So I did want to go over how that implementation has been. We have done our historical award import. We did do our grantee training, and we did our initial application score user testing. We have our renewal application in progress right now. That would be Denver Recovery Group and Advocates for Recovery are serving as our user testing for that. And those are due July 31st. They have a technical assistance webinar on July 1st. We are working on making our fund balance align with Workday. So the fund balance would be all the money that GROC has received to date. That is our primary fund. Then we also have our accrued interest fund, which is a little over $800,000 at this time. Then we attach all of our awards to those funds to make the in and the out money match what we have in Workday. We will have an onboarding for voting members at the July 27th meeting. That way you can get in there and score the renewal applications using that system. We have our general RFA application. Will be finalized in November after our strategic planning meeting in October. And then we are working on developing some workflows for that RFA application, for our contracting, for staff change forms, budget amendments. And then we are aiming to close out implementation somewhere between May and June of 2027. So I will share kind of our Gantt chart from our implementation team, and then I will give you a brief demo of what EUNA looks like. So here we have some configurations to do, project management, pre and post award. The checklist is very long. So here are the two funds, our general fund and our accrued interest fund. And it gives us these cool graphs of how much we have obligated, not obligated. So again, just trying to reconcile those numbers in the system with our spreadsheets so that we can get rid of our multiple spreadsheets where our target is. And huge thank you to Resilience 1220 who said I could use their account to show folks what it looks like. So they do have a landing page. It does show how much they have invoiced to date. If they have a pending invoice waiting for an approval, and that is a two-step process. So it will go through me and then it will go through Amber. Amber will put it into Workday and issue the payment. My long-term goal is to get an API integration where will talk directly to Workday and we can take out a middleman. That way we ultimately cut down the time to as close to 2 weeks from expense reporting to payment as possible. I have not yet learned how to run reports, but I have tagged all of our awards so that we can run reports on how much we have spent by funding area, by service area, all together. And so when folks submit an expense report, they can engage with their budget in real time. Maybe. Yes,
I'm sharing it with the fingers so we can do this.
it was working so well.
Mhm.
I'm gonna stop sharing to see if that helps it go faster. It does not. Is everyone's Wi-Fi working? Yours is working?
Yeah.
That has to be a Una.
Well, I'm not working. So, okay.
I might come back to this just so we're not sitting in empty space. But it does show everybody their budget and then their line items, how much they have expensed in each line item, how much is remaining in each line item. And then when they submit an expense report, there is a demo in our executive committee meeting from earlier this month if folks want to go back and watch that. They have to invoice at every line item with supporting documentation in that line item. So it does make our invoices so much more efficient, so much more audit friendly. Is it going to work? It just does not want to load the budget page. Are there any questions about AUNA? Oh, there it goes. I'm so excited. So it shows you here, and then we can see actuals and remaining. So this is available to grantees in real time. Every time they submit an invoice, it automatically deducts how much is left. That way we can see where money is over. Resilience 1220 is a historical import, so we are trying to mitigate what was imported and what line items are correct or off. But it does allow us to track that. I might be able to show an expense report. This is such a great investment, everybody. So it shows you right here per category, what they have to invoice by, and then it goes by line item, how much they invoice, and then it'll show how much is remaining. So again, it's just so much more efficient, accountable. It gives us great transparency. We've been able to reconcile several audits this way, and it just saves so much time. Having a uniformed format for how we invoice here. And then it keeps a log of what was approved and when. So again, still building out some of our workflows for like our approval, how we handle contracting in eUna versus email. We do have some of our forms in here. So if they have multiple awards, they have to report that to us. If they have a staff change, and so we've been looking for Susie Q in the staff, but now we're going to be looking for John Doe in the staff. They tell us that so we can keep track of what is happening with the award. Any questions on eUna and our implementation so far? I'm not seeing any. Great, we'll move on. I will call on Rhiannon Straight to talk about this. We do need a vote from the council. Omni has a community strategic planning survey that was initially scheduled as a deliverable in 2027, but we do think it might be beneficial to move that up to July and August of this year. That way we have the results to inform the direction of the strategic planning summit in October. And I will go ahead and kick it off to Rhiannon.
Thank you, Dr. Chelsea. Can folks hear me okay? Just quick sound check. Okay, awesome. I think Chelsea just did a pretty good job summarizing the plan. I'll give a little bit more information about the survey itself and the reason that we need a motion from this group. This survey, we have actually distributed across multiple regions in the state, and every time we've done it, we've gotten some feedback and kind of redeveloped and improved. So we feel pretty excited about where it stands at this point. And it was always written into our contract and our scope of work. We just weren't quite sure when it would be the most appropriate to distribute. So the question today is just logistics based. We estimated this would be in 2027. It is actually better off in 2026 so that we can use findings to inform your strategic planning conversations at the summit. That's the only discussion point or like decision point to make today. The survey itself is developed exactly around all of the categories and then subcategories in Exhibit E. We frequently talk about them in treatment, prevention, recovery contexts, and it allows community members, healthcare providers, people with lived experience, local municipality employees, really anyone that we can get their hands on the survey to fill it out, to tell you all what is most needed in the region as it pertains to Exhibit E. So not only like we need prevention, but which Exhibit E subcategories of prevention do folks think are most needed and relevant? So by moving this from 2027 to 2026, we can distribute it this summer, analyze the results, and then present them to you all at the summit so that you can see exactly what the community deem most needed or maybe most important to help continue to chip away at that prioritization process that you'll be working through. I'm going to pause. Questions, concerns, happy to answer them. Otherwise, we would be looking for a motion to move Omni's community survey line item from 2027 to 2026 in the UNA budget. Go ahead, Commissioner Dahlkemper.
Great, thank you so much, Rhiannon. I am very excited to see that we're moving this up, and I'm especially excited to know that we would be releasing the results at the summit, which I think also provides a very timely, not only timely information, but a newsier angle as well as we work to engage our community around these issues, even if it's providing information or also demonstrating how they're part of this process and how their feedback is helping to inform our decision making. So I think that'll also be a good point for us to think about too, as we think, as we've always done for these regional summits, about the media component. But just what a wonderful piece to include. Thank you.
We're excited about it. Any other questions? I will say this survey is only as good as we can get it out into the community. So once we have this approved, we'll kind of we actually already have it developed. So we'll get with Dr. Chelsea on a timeline and everything. And then we'll need all of your support to spread it wide and far. And we'll get going on a plan for that as well.
Chelsea, I'll move that we move the Omni Strategic Planning Survey from 2027 to 2026.
That was Commissioner Hollingsworth.
Second that motion.
Commissioner Marlin, second. We'll vote by opposition in the chat or in the room. And that has passed. Thank you. So Rhiannon and I will work on that distribution plan at our next touch point. The next agenda item.
Thanks.
Go ahead.
Just saying thank you.
You're welcome. Thank you. The next agenda item is of importance to the Jeffco Public Health Award discussion that immediately follows. So we have discussed revisiting our conflict of interest statement. I did drop a link in the chat to our standard operating procedures manual. The current conflict of interest statement is on page 30. As discussed and recommended by the advisory committee, as well as with the executive committee, the current language treats an entire local government as a single entity. So as a result, a member may be considered conflicted on funding decisions involving any department within their jurisdiction, regardless of whether they have any direct involvement with or financial interest in the applicant organization. So that would be like Dr. Ryan has a conflict of interest on Mountain Youth Network and the CCHAT corresponder program, but we would like to broaden our conflict of interest statement so that he does not have a conflict of interest on CCHAT, because even though it's part of Clear Creek County, he has no decision authority over that organization, but he does directly oversee Mountain Youth Network. The commissioners would have that conflict of interest as they do have an interest in the jurisdiction. Likewise, Dr. Story is the director of public health in Jeffco, would not have a conflict of interest on the Jeffco Sheriff's Department, and Jeffco Sheriff's Department would not have a conflict of interest on Jeffco Public Health. Broadening that was again supported by the advisory committee and the executive committee. So the language has been recasted to focus on a direct financial relationship between a voting member and the entity receiving funding. So a conflict would exist if a member is employed by, serves on the governing board of, or has a substantial financial interest in the applicant or recipient organization. That would not, that's like a governing board. So all of our commissioners do serve on the JCMH board, but that's not really governing. That's like an advisory committee. So that would not be a conflict. There's no conflict for a member who works for a separate department, agency, or organization within the same county that has an independent governance and budget authority. So this language was approved by GROC Legal to meet those criteria. This is in the meeting materials packet. Let me know if I need to zoom in. The floor is open.
Be first, but I have a question. Let's see who else has questions. Okay, I'm curious about, like, just a random example. Sarah Casano, Department of Human Services, separate department. I don't know if you could call the governance independent because they both. So Director Casano, the question is, would she have a conflict of interest on decisions about Clear Creek Public Health? They both are under the Board of County Commissioners, report to the county manager. Does that independent governance clause mean that she would have a conflict of interest?
I'm going to piggyback on that question. This is Sarah Story.
No, you gotta speak that.
Piggybacking on that question, in Jefferson County, health department is a separate legal entity. So BCC has budget authority for half of our budget, but our operating budget is approved by the Board of Health, which is my governing body. Like, that's who I report to. So in that instance, if Clear Creek Health Director reports to the county manager, that puts them in a little bit of a disadvantage from a conflict of interest perspective because we are separate. And so I'm just adding that layer that is not the case for Jefferson County, and I don't want to have an unfair advantage just because I don't report to a county manager. So I'm just throwing that out there as well. I think at its heart, my comment is, this is a good idea.
I am not a lawyer, so I will defer to Carrie if we are achieving these goals in this policy. I don't think that Sarah Casano in the Human Services Department at Clear Creek would have a conflict of interest on Mountain Youth Network or on chat. But you, George, as the commissioner, do have a conflict of interest.
That part is clear. So I'm curious, Carrie, do you agree with that interpretation? I just want to make sure that I'm leaving this room understanding.
What I think is, based on this discussion, that Chelsea and I can perhaps refine this to get to the intent so that it's clear. Ideally, it should be clear on its face rather than us struggling to use these examples. So we could incorporate examples in the policy itself, but I think that based on this discussion, there's some good questions raised that could bear clarifying in a revised version of the policy.
And when it matters, one step is when we do application review. So that's partly part of the conflict, right? We wouldn't want X person reviewing contracts for a fellow coworker department as part of it, but they would if there's a separate entity operating in their county, even if they partner on programming. That's what I'm wondering, because
Correct.
I could see Human Services and Public Health partner on programs, Public Health and Recreation partner on programs, but I don't know that they really have a conflict because they don't have control over the final decisions and the budget.
Correct.
Right.
And I think, to reflect the intent, I think the intent is that this match with general approaches to conflict of interest. They're pretty clear. Like a layman's approach, the answer, I think, ought to be no, that Director Casano has no authority over the public health department and therefore should not have a conflict of interest.
I agree with that, Commissioner. I agree with that.
This language may get us there. It's just that operates under separate management. And if you say on the record here you think it gets us there, that's good enough for me. I don't know that we need to go back and redraft this personally.
To me, it sounds like the clarification is between management and budgetary authority, which is two different things, because the BCC has budget authority over me, but they can't fire me on their own. They would have to go through my Board of Health, which in some counties is the same thing. So in some counties, if it's 2 and 1, then that would be different. It's management versus budgetary authority that I think where the conflict of interest lies. And maybe just slight clarifications of the difference in those two things would be great. I see it coming up when we discuss applications, where then you have an entire group of people who can't talk. And then you have two groups who are asking questions that can't be answered, or you have to toe the line a little bit
So personally, I think why would Sheriff Marinelli have to like censor herself over something that has nothing to do with even we just happen to share a general employer. It adds the other level that like with the sheriff being elected, Commissioner Dahlkemper being elected, I'm appointed, and then Mary Berg is a career employee hired by the county manager. That's like 3 different spaces. So that isn't going anywhere. So I think if we can refine the language for us, that would be evergreen. Beyond us being here, that would be wonderful. But I feel like it's almost there, but maybe just another Passover would be great. I mean, Carrie's perfect and never makes mistakes. This is just a further clarification.
Yeah. And I drafted it for Carrie, and I'm not a lawyer. So
very legal. I was gonna say that was very lawyer sounding.
So I guess if Carrie is okay with this, what I would be looking for is that we all seem to be conceptually on the same page of defining a conflict of interest, is that we can delegate the executive committee finalize the revision. Carrie and I will go back to the drawing board on how we need to refine this draft to make sure that it is meeting our conceptual standards. Can we do that? Is that okay? And then enact it today?
Yes.
Okay.
If you have a motion with what is needed to clarify it. And I think this discussion is just clarifying where, there is some ambiguity. The intention that's being expressed is what was intended in the draft that's before the council today. So we're just looking to clarify.
I'll pause for just a moment to see if anybody else has any other questions or comments before I make a motion. Okay, I'm going to move we adopt this updated conflict of interest policy with a minor clarification with matching the intent that effectively people that don't control another entity inside the same government don't have a conflict of interest with respect to that entity.
I'll second.
That was Commissioner Dahlkemper who's second. We'll vote by opposition in the chat and in the room. Awesome. So that will take effect today. So Commissioner Dahlkemper and Dr. Story would be the only 2 people who have a conflict of interest on the Jeffco Public Health Award being discussed today. Michael Miller is not a voting member, he's an alternate. So there is a historical context document in the meeting materials packet. We will have a needs assessment presentation by Michael Miller and his team. And then Jeffco Public Health will give us a presentation on how the needs assessment translates into a revised scope and budget. We will open the floor for discussion and vote. This is our last agenda item because we have had several conversations about this that have been very robust. So just a quick review of what this is. Jeffco Public Health was awarded a roughly $1.5 million conditional award in June of 2025. They were given an early release of funds for phase 1 of their award, pending a needs assessment of harm reduction needs in the mountain counties. Today we are discussing the results of the needs assessment and that translation into if it is a revised scope of work, if it's a single county, 2 county, which 2 counties, all 3 counties, collaborative harm reduction project. I'm not going to read this to you. I'm just going to go ahead and turn it over to Michael Miller. Let me make you a co-host.
Awesome. Thank you, Dr. Shore Miller. Am I good to share now?
Yes, you should be.
Awesome. I'll just do this part here. Y'all see that okay?
Yes.
Okay, awesome. Hi, everybody. My name is Michael Miller. I use he, him pronouns. I am the HIV and Harm Reduction Program Manager for Jefferson County Public Health, and I've had the honor to work with the council for a very, very long time, and excited to be here with y'all today to, like Chelsea said, share about the needs assessment findings and our resulting proposed approach. I do have a section for questions at the end. So I know we're on a short timeline, so I will get this done in 15 minutes or less. So over the last several months, we've completed the regional needs assessment that was contemplated within the original award, and I'll share the key findings from that assessment, discuss the recommendations that emerged from the stakeholder engagement, and demonstrate how our revised phase 2 budget aligns with those findings. Ultimately, we're requesting for approval to move forward with implementation, with one quick caveat that I'll talk about here in a moment. So starting with what we learned here, the purpose of today's presentation is super straightforward. Go through the major findings, discuss the recommendations that emerged from the assessment process, and then demonstrate how those recommendations informed our strategy. And then finally request approval of the revised budget so we can begin delivering services ID'd through the assessment. And before getting into the findings, just briefly revisiting the purpose of the project. And so when the project was awarded, the intent really wasn't just to simply expand for like expansion's sake. The award was kind of recognized two realities, one being that existing opioid abatement activities are already serving significant need and require sustainment. And the second being that unmet needs continue to exist throughout the region. And so the project was designed to both sustain effective services and expand access where gaps existed. And the needs assessment was commissioned specifically to ensure that implementation decisions reflected regional priorities rather than just assumptions. And so the assessment was intended to guide the implementation. So what do? We JCPH independently contracted with Equilibrium Collaborative as a unbiased third party to complete the needs assessment. Big thanks to Dr. Story for helping getting that taken care of very quickly and getting us a really solid contractor there. And so the needs assessment included interviews, partner engagement, service provider input, and then review of regional resources and service gaps. And we heard from stakeholders, well, I guess Equilibrium, heard from stakeholders representing different sectors and different communities throughout the region. And the central question was consistent across the board, and it was what barriers prevent people from accessing overdose prevention and harm reduction services. And again, we weren't asking whether need exists, we were asking why people can't access help, and the findings were pretty consistent. And so unmet needs exist throughout the region, finding number one. And it was one of the clearest findings that was repeated really frequently was that substance use and overdose risk exists throughout Jeffco, Clear Creek, and Gilpin counties. Scales might differ, visibility might differ, but stakeholders consistently ID'd ongoing need. What varied wasn't the presence of the need, it was access to the services. And so we know need exists throughout the region, consistent and equitable access to services doesn't. And that led directly to the second finding, being that access barriers remain significant. And so transportation barriers were repeatedly identified, geography was repeatedly identified, and awareness of services was frequently ID'd. Stigma also, as usual, remains a significant barrier for a lot of individuals. And we're discovering that while a service may technically exist, if a person can't realistically reach it, that service isn't truly accessible. And so availability and accessibility are different things. And so how do we overcome these barriers? So the third finding, and that outreach and peer engagement are critical. And we heard repeatedly that outreach and relationship building were really important. And a lot of folks emphasized mobile outreach, peer engagement, and trusted messengers. And then they also emphasized like consistent relationship-based services. And we know from our work here at Points West, and I'm sure many of y'all do, that people engage when they trust the folks in front of them. And so key message here being that services are effective when they're delivered through trusted relationships. And then the assessment also highlighted the need for stronger OD prevention capacity. And stakeholders consistently ID'd overdose prevention as a priority. And that's stuff like naloxone distribution, overdose response education, monitoring emerging drug trends, and arming people with as much information as possible about the supplies and resources available to them, but also what is in their current drug supply. And that communities want practical tools that help people make informed decision and reduce OD risk. And so OD prevention, it's opioid settlement funding, so hopefully this is a main priority, but that's a central regional priority. And then the final major finding was really focused on infrastructure. And we repeatedly heard concerns about fragmented services being disconnected, communication and collaboration being inconsistent, though it is happening in spaces, and that resources can be difficult to navigate. Stakeholders emphasized the need for a stronger regional coordination and sustainable infrastructure to support implementation, and sustainable being really key. I've heard a lot about how there'll be starts and stops to things, and people will hear a rumor about something started and then go look for it and it not be available anymore. So programs aren't enough by themselves. Systems and collaboration and coordination are required. And taken together, these findings led to 6 recommendations. And so the recommendations weren't surprising. The assessment didn't tell us to abandon what works. It told us to really strengthen and expand what works. So more outreach, more peer engagement, more OD prevention resources, drug checking, regional coordination, and sustainable infrastructure. The recommendations align directly with evidence-based practices already demonstrating success. And the revised budget that Dr. Shore-Miller shared with everybody was redeveloped specifically to address those recommendations. And so for budget alignment, this slide is really the bridge between findings and implementation. So every major investment category can be traced directly back to the needs identified through the assessment. And nothing in the budget exists in isolation, and each category's response to a documented need. So the budget follows the assessment. Staffing is the largest investment, and for good reason. Services don't deliver themselves. Outreach requires staff a lot more than you think it would initially. I've learned that the hard way. Peer engagement requires staff, drug checking requires staff, regional coordination requires staff, and the assessment repeatedly emphasized relationships and engagement. And I think one of the first really solid learning opportunities that I had, that Jeffco had in this entire process with GROC, is that we have a ways to go in supporting that collaboration and that coordination. We could have done a much better job in coordinating communication on the front end and saved everybody a whole lot of time and capacity and heartache. But I think it taught, at least me, a really important lesson about really proactive and ongoing coordination and communication with our partners regionally and locally. Key message here being people are the delivery system. And then another specific recommendation was drug checking. Drug checking emerged as an important regional opportunity. FTIR, which is the type of drug checking technology that we're proposing using, allows us to better understand the local drug supply, really importantly, identify dangerous contaminants, provide real-time participant education, which is very, very important. We're noticing right now, we currently have a mail-based drug checking program as we're laying the foundation for the FTIR program. And one of the biggest pieces of participant input we're receiving through this pilot is that 2 weeks is too long to wait for results. So the opportunity to provide real-time information and data to participants is what they're begging for. And it's obvious to see the value. And it obviously supports overdose prevention efforts. And so an investment there in FTIR drug checking directly addresses assessment recommendations around OD prevention and those emerging drug trends that I mentioned earlier. Drug checking is an educational and an OD prevention strategy, and it is also only one part of the infrastructure needed. And so the regional hub that we're proposing provides the operational foundation necessary to support implementation. All of the things from training, storage, we require a lot of storage space for all of our supplies that we distribute, space for coordination, space for partner collaboration, a hub for operational support. And it's not simply a building, but it really is the infrastructure that will continue to enable sustainable regional service delivery. The hub supports everything else. And strong implementation also requires accountability, a piece that for those of y'all that know me, know that I'm pretty intense about. So in terms of accountability and oversight, the project includes really exhaustive and extensive accountability mechanisms, including financial oversight, performance reporting, deliverable tracking, measuring outcomes, the oversight of the regional council. We also underwent the Colorado Opioid Abatement Council review for supplantation and received confirmation that implementation can proceed, but we need to complete one final recommended review process for individual line items just to confirm supplantation. I think Dr. Shore-Miller can speak to that a little bit here when we're done. But at its core, the project has multiple layers of oversight and accountability. The one additional piece that I will add there is the most important piece of operational accountability and oversight for us in the program are participants. So we have an initiative called the Participant Advisory and Leadership Initiative, where participants are compensated for their time and expertise to tell us what we're doing well, what we're doing wrong, and what we need to adjust. And I would pose that as one of the most important oversight and accountability mechanisms that we benefit from. And then what does success actually look like? Success isn't, in my opinion, measured by dollars spent. It's measured by impact. More people reached, more OD prevention resources distributed, more peer support connections and navigation, more engagement, stronger partnerships, and greater regional capacity to respond to the substance use related harms and opioid related harms. Success means improved access and improved outcomes. And you can see we came up with a design for our 10-year anniversary as a program, which we just had a party for last month. And that's just our fun little Dodge minivan that we're cruising around in until the retrofit and the budget is completed. So that brings us to today's request. Needs assessment confirms significant unmet needs across the region. The recommendations appear pretty clear. The proposed budget directly aligns with those recommendations, and so we're requesting the approval of the revised phase 2 budget, and that's subject to additional review processes, that being the supplantation lemon test, and then I assume, and I need Dr. Chelsea to confirm if that would be a executive committee approval after that process, or if we do need to come back in front of council, whatever we need to do on that front, and we'll have that returned by as soon as we're able to get just some final clarification on it. And yeah, I think that's everything I've got. Thank you for your time. Let me spit all this out so quick. I'm happy to answer any questions.
I will open the floor for discussion, comments. Commissioner Dahlkemper can ask questions. Dr. Story can answer questions. You just can't, neither one of you can vote.
Is there anyone new on the call today that might not know the relationship between public health and Points West.
Commissioner Hollingsworth asked if there was anyone new on the call who might not understand the relationship between Jeffco Public Health and the Points West program. Program.
Yeah. I can answer that. Can I answer that?
Yeah, go ahead.
Sure. Points West is a program of the health department. They're a full member of the health department, and they operate in our clinical services division. It's floating in the background.
Yeah. Are there any other questions about this process, our due diligence? So I am looking for three things today. I am looking for a motion on the number of counties to participate in this collaboration. If it will end up being just a Jeffco only project, if it will be 2 counties and which 2 counties, or if all 3 counties will participate in a true regional collaboration. The second thing I'm looking for is a motion to extend the award either 6 months or 1 year, because it's way easier for Amber and I to manage if it's even. That way there is an exact 2 years of on the ground services being provided. This was a discussion in the meeting of public health directors and in the executive committee that both groups would like to see. And then I'm also looking for a delegation to the executive committee to finalize the budget at the July 6th meeting. That way we can move a little bit quicker and this award does not have to wait another month to have the full budget come back to the full council. The floor is open.
I'll make the first motion if everyone's being shy. So this is Commissioner Hollingsworth. I will move. My understanding is that all 3 counties would like to participate. So I will move that this program and application will apply to all 3 counties, Jeffco, Clear Creek, and Gilpin.
I'll second that.
Commissioner Marling, second that. We'll vote by opposition in the chat or in the room.
Oh, I'm voting head.
Okay, first motion down. Thank you. Second motion that I am looking for is to extend the award between 6 months to a year. That way there is 2 years of on the ground services. This might come with a budget increase. That would be, you can also make a motion that you would like to see this without a budget increase. I don't know how that would happen. But that kind of feeds into that delegation to the executive committee to finalize. Are there questions? Commissioner Dahl-Kemper.
I thank you. I just have a clarifying, this is a housekeeping issue and probably a Carrie question. As JCPH and I as Jeffco are conflicted out, do we need to demonstrate on the record that we are abstaining from these votes in the chat, or is that inherent in the fact that we're conflicted out? I just want to make sure for reporting purposes we're okay.
I did announce that you could not vote at the start of the conversation.
So that should cover it. We don't need to put anything in that. Okay, perfect.
Abstain
I
every
did hear
single
that,
time.
but thought I'd double check. Thank you. Sorry.
And I will use the correct language going forward to clarify that.
See Carrie and Mark.
No worries. Perfect.
So that's a legally binding thumbs up. Okay, then I'll make the motion just with some commentary. I think I don't know how you start a program and adequately evaluate it in less than 2 years. And so I move we extend the award to allow for 2 years of services from the contract date.
So the contract date is January 1st, 2026. 2 years puts it at December 31st, 2027, because that's 2 calendar years. If we wanted to look at from services, that would extend the contract to either June 30th of 2028 or December 31st of 2028.
So allow me to amend my motion. My intent here is that is there going to be a contract amendment that
Yes.
so to allow for 2 years of service from the contract amendment is the motion. The award is extended to allow for 2 years of service from the contract amendment.
Can you give me a date? Because signatures,
I'm intentionally trying not to, because it sounds like you don't know the date yet.
well, and Dr. Story can speak to this, is signature processes could take a while. And so I really don't want an award to stop in the middle of the year. That is so difficult for Amber and I to track with 14 different contracts. So if you could say like December 31st of 26, 7, 8, that would be the clearest thing for me.
December 30. So okay. So then I move to extend the award to December 31st, 2028.
Thank you. Okay. Is there a second?
This is Laura. I'll second.
Yeah. God, there are people in this meeting. We will vote by opposition in the chat. All right, and that leads us to the next delegation. Ideally, someone on the executive committee is not giving this delegation. So I'm looking at Under Sheriff Gmo, Tori Jantz, Sarah Casano, Laura Weinberg, Kristen Heath, Janine Mariani, Jamie Baker, Barb Weinstein. I'm looking for a motion from any of you. Heidi McCollum. So this
Dr. Chelsea, I can make the motion well, wait, let me see.
So this is delegating to the executive committee the finalized budget. So that would include the kind of like lemon test of supplantation of every line item. And then that could potentially include an award increase because we just requested extending the award almost exactly 12 months. You can make that delegation however you see fit. Like, for example, it could be the executive committee can approve the lemon test and they can approve an award increase no more than $500,000. If it's over $500,000, it has to come to the full council. It could be 10% of the current award.
I'm no longer making this motion because now I'm confused.
How can I clarify? Because if you're confused, others are probably confused.
Is there a proposed motion or those are specifics? I didn't hear enough discussion to like be able to say like what those specifics should be.
Those are just examples. It could be whatever your heart desires. The budget does have to undergo a sort of like lemon test. So the COAC or the State Assistance Committee has 6 guiding questions on supplantation. Every line item in the current budget is subjected to those 6 questions. So Michael and Dr. Story are working on answering those 6 questions. That could definitely be delegated to the executive committee to approve. That could be delegated specifically to Amber and I to approve since we're the ones who requested that. But then we just made a motion to extend the award 1 year. I anticipate there's going to be a budget increase needed for that. So you can put parameters on what the executive committee can approve. If they can approve $500,000, if they can approve $1 million, if they can approve half of the current award, which is like 1.5 divided by 2. What is that, like 625? Or it has to be the same. Any increase in budget has to come back to the full council on July 27th. Are there questions from non-executive committee members of what is happening at this point in time?
See Rhiannon unmuted.
Trying to decide if I'm being helpful or just get in the way. I think what could be helpful to get to have folks feeling more comfortable to try to make this motion is to understand like pros and cons of that budget limitation, or like this is how we handle it in a different context. I know there are certain caps that this region and other groups make on how much money they allow their executive committee to make decisions on. And so like, are we comfortable with council not knowing that this project gets more than their initial award? Do we feel comfortable maybe allowing the executive committee to make this full decision because we know our executive committee? I feel like people are uncomfortable proposing the budget figure that is needed to specify the motion. So if there's any direction for us around that, I think it would be helpful.
Let's it was just what really all we need is for a motion to delegate it to the executive committee to finalize the budget. I thought that was kind of it in a nutshell.
Commissioner Hollingsworth was asking a clarifying question if all we needed was a delegation to finalize the budget to the executive committee. Yes, and currently, per our grantee playbook, any budget amendment that results in an increase to the award has to come to the full council. The executive committee cannot approve any increase to an award. The issue is that we just extended this award by 1 year. I don't know how that is not accompanied by some type of budget increase. So does the executive committee have delegation to approve that?
So, okay, I'll share, and maybe we can just try to have some dialogue here. Curious how people react to this. I think giving the executive committee the option to make increases to this award, if necessary, may help these services get to the ground faster. Rather than otherwise, if there is some reason that the executive committee decides, you know what, we think that there's a need for some additional funding for some reason, because of the extension of this timeline, we would have to come back to the GROC. And so I think the right question is like, I heard Dr. Shore-Miller throw out $500,000. I see Dr. Story shaking her head being like, we don't think we need $500,000 more. I'm doing body language, doctor, and I shouldn't. So I think that from my perspective, and I do this sitting on the executive committee, is that the best way to get these services to the ground is fast is to decide on a number we're comfortable with. And I would propose as a straw person that we allow the executive committee to increase the budget up to $500,000 before it has to go back to the GROC. I would say that knowing we have members of the executive committee that are probably interested in a whole, or many members of the executive committee that are going to be very reticent to approve budget increases. This is already a large grant, as was discussed a year ago when we initially approved this application. So does that help clear things up? And does anybody have a reaction to, is $500,000 more trust than we should give the executive committee? Is the right amount of trust, knowing that all of this would be reported back to the GROC?
And then I have another question. This is Commissioner Hollingsworth. If there's no dollar amount in the motion, it would need to come back to the full council. And the only concern with that is delaying the implementation.
Correct.
Otherwise, that's an option too.
Yeah. So then I saw Barb Weinstein unmute, and I see Under Sheriff Demo unmuted.
And then I'm going to read Sarah's comment in the chat, then we'll go to Barb, and then we'll go to Demo. Sarah Casano says, sorry, I still can't unmute. I'm wondering if you would typically see a percentage of a budget increase or just a dollar amount. I don't know if that's a typical, I would have to like do the math on how much staff they have. I did just throw on the slide that if this is a $1.5 million award for 2 years, we increased it 1 year, a 50% increase would be about $762,000.
Yeah, answer the question that's embedded in that. May I answer the question that's embedded in that calculation? Yes. Is that assumes a consistent spend over time, whereas this first kind of like upstart of the award is not really like the award. You know, we're operating now in this very strange limbo. The spending is exponential because the startup or backwards exponential. You get the startup costs in the infrastructure, and then the marginal cost of every additional month is not going to be consistent. So from my experience with other types of awards, I think this approach of saying, here's a reasonable cap based on this calculation of 500,000 or something like that. And if needed, to come back to the full council, remembering that this will be rolled out in phases, that it doesn't mean come this time next year, we may have to revisit and say, oh, well, we did need this third band because we're popping up here in Georgetown and we're up here every day. So I just saying that's my experience with this type of stuff in public health, is that it's often take something like a 50%, since that's how much extra time you would be operating, and then reduce a little bit because of the delay in spend so far. But that's just, again, experience, not a conflicted statement.
Let's go Barb and then Demo.
Thank you. So I think I finally got it. So thank you very much for all of the added explanation. This is not a no-cost extension. It is an extension of the contract, meaning that dollars have to flow with it. So from my perspective, I am perfectly comfortable at that 500,000 because one, that's less than the 50%. Understanding that's like a not to exceed amount, perhaps, before it has to come back to the full board. And I'm perfectly okay there.
Under Sheriff Demo.
So I was basically going to echo what Barb just said. That came up in my head about 35%, which I think is around that 500,000. Anything more than that, I think it needs to go to the whole board.
Okay.
Thank you.
I love that we're getting opinions. Anybody, and I don't mean this in a condescending way. This is really great. Anybody else have opinions?
I think I can make. Oh, go ahead.
Go ahead.
I was just going to say I think I can make the motion now, but so if there's any other comments before I do that, please.
No, mine was just an optimistic thought that perhaps they'll get some grant funding in the 2-year period and not need more funding from GROC ultimately.
Okay. I will move to get delegate the approval of the supplantation test to the executive committee and the finalization of the budget, making increases to the award if necessary up to $500,000. Does that cover it all?
I think so.
Okay.
Looking for a
I will second that motion.
Thank you, Under Sheriff Demo. We will vote by opposition in the chat. There's none in the room. And this passes. Thank you all so much. That was our last agenda item for the day. So again, as a reminder, we have 2 applications currently doing their renewal application because their awards expire this year. They had 1-year awards. Those will close July 31st. The full council will have a UNA reviewer onboarding on the July 27th meeting. That is a very important meeting. Please attend. You will be claiming your reviewer profile and learning how to score and access those applications. Your scores will be due to me after 2 weeks. I will run some reports and then we will have a full council discussion on those 2 renewal applications on August 24th. That will be a hybrid meeting in Jeffco. Thank you all. I hope you have a great rest of your week. Happy 4th of July coming up.
Thank you. Bye, everyone.
Thanks, everyone.
Bye.
Every time someone says the 4th of July, I just like,